So our next speaker is Dr. Padmamalini Mahendra. She's heading the Uveitis and Ocular Immunology Services at Narayan Nethralaya, and she's also the Vice President of the Uveitis Society of India. So over to Dr. Padmamalini.
Yes.
So she has a case of post-fever retinitis, something that we have been seeing very commonly in the past few years. Yes, doctor.
Yes. Thank you, Dr. Dinko. At the outset, we thank the scientific committee for giving us the opportunity to have a case-based discussion. The title of the presentation is Be Careful of What You Drink. I'm going to present a case of a post-fever retinitis. Here, a 33-year-old female, homemaker by occupation, presented with blurring of vision both for distance and near since 3 days in the left eye. She's pregnant, 14 weeks of gestation, and she was apparently fine 3 days back. The past history, she gave history of fever with sweating 1 month back with migratory arthralgia, which was treated with antibiotics elsewhere. The ocular symptoms started exactly 1 month following the fever. General examination and systemic examination was normal. Ocular examination, uncorrected visual acuity was 618 in the right eye, 660 parts in the left eye. Intraocular pressure was normal. Anterior segment examination was normal in both eyes. This is a wide field fundus photograph, shows clear media, hyperemia of the disc, multifocal retinitis in both eyes. OCT shows hyperreflectivity with aftershadowing in the right eye. In the left eye, loss of foveal contour, hyperreflectivity with aftershadowing, subretinal fluid with hyperreflective dots, what classically described in a case of a post-fever retinitis. This is a multicolor imaging showing involvement of more changes in the blue and green reflectance than the infrared reflectance. Coming to the investigations, the blood counts were normal, regular workup for retinitis were negative, urine microscopy is normal. Coming to the post-fever retinitis, sincere fever, the typhoid was ruled out by viral test is negative. In the COVID season, SARS-CoV-2 antibodies were negative. In dengue, platelet count was normal, both IgM and IgG was negative antibodies for dengue. Chikungunya is negative, Bill Felix test is negative. So we ruled out the common causes of post-fever retinitis. In spite of that, the patient had symptoms. So history of fever, migratory arthralgia, we did suspect brucella. When we did that, brucella antibody came positive. We started the patient on topical steroids along with oral azithromycin because she was pregnant. We were not able to put doxycycline. The doxycycline can be used in pregnancy with caution, but we did not want to use it as a first line of drug in this. She's just 14 weeks pregnant. Follow 10 days, started showing resolving retinitis with decreasing in the SRF in the left eye. This is a multicolor imaging. In the third visit, you could see the resolving retinitis. However, hyperreflective subretinal echoes were present with hyperreflective dots. This is after 6 weeks, complete resolution of the retinitis with thinning of the inner retinal layer was seen. So this is a summary. This is at presentation. This is the second visit. This is at 10 days of follow-up, and this is at 6 weeks follow-up. Showed complete resolution of retinitis. The course is similar to any post-fever retinitis. However, we could see the anatomical changes as a thinning of the nerve fiber layer in the retina in this case. Coming to post-fever retinitis, all have history of fever. 2 to 6 weeks later, they can present with blurring of vision. Morphologically, they all have retinitis, retinal hemorrhages. Recently, we described ring-shaped retinitis in a case of a post-fever retinitis, commonly in rickettsia. So it could be dengue, chikungunya, rickettsia, West Nile, and recently SARS-CoV-2 have been added in the literature. We did rule out all this in our case. The brucellosis is a bacterial infection caused by the gram-negative non-motile bacteria. It occurs due to ingestion of unpasteurized milk or contact with infected livestock. The clinical features, undulant fever, sweating, and migratory arthralgia classically was present in our case. Associated with GI symptoms, blood tests can show low blood counts and increased liver enzymes. Coming to the ocular features of brucellosis can have pure ophthalmic or neuro-ophthalmic or secondary to brucella complications. The pure ophthalmic could be conjunctivitis, all itis, keratitis, episcleritis, dacryoadenitis, and anterior or posterior uveitis, the choroiditis, endogenous endophthalmitis. Neuro-ophthalm can have optic neuritis or retrobulbar neuritis or cranial nerve involvement. Secondary brucella complications can occur secondary to thrombocytopenia with emergent tendencies. Coming to the pathogenesis, it could be secondary to the direct infection or due to the immune complex depositions, immune mediated, which we see in most of the post-fever retinitis. We make the diagnosis based on the eye index of suspicion. The brucella serology helps us to confirm the diagnosis. We treat them with antibiotics. The commonly used one are doxycycline and also the rifampicin. In this case, we give it for prolonged duration, not 2 weeks course like in other post-fever retinitis. Here, 4 to 6 weeks antibiotic course is given along with corticosteroids. In our case, we avoided corticosteroids because of the pregnancy. Even without that, the patient responded well to treatment. Basically, brucellosis and pregnancy, absence of erythritol in the human placenta promotes the brucella growth. The presence of anti-brucella activity in amniotic fluid would prevent infection of the human fetus, which has happened in our case. The child was fine. So, brucella and pregnancy can present with bacteremia, acute febrile reaction. Sometimes they can have DIC kind of a picture, and endotoxin, uterine smooth muscle contraction can result in loss of pregnancy. The systemic symptoms are similar to systemic brucellosis of any other etiology. Eye index of suspicion, early recognitions and treatment resulted in control of not only the infections but also the ocular inflammation in this case. Thank you for your attention. I would like to acknowledge the team members for the contribution. Thank you.
How common is this post-brucellosis retinitis? How often do you see brucellosis?
This has not been reported in the literature, but ocular manifestations of brucellosis have been reported, and especially it occurs due to the drinking of unpasteurized milk, and treating them with appropriate antibiotic helps to control the infection. Most probably, this is something we have reported secondary to rickettsial, chikungunya, dengue, and recently we reported secondary to SARS-CoV-2. So we wanted to add brucella in the list of post-fever retinitis. So hope to see this soon in print.
Any comments? So do you see, McCluskey, how common is it in your country?
It's very uncommon. We probably see more leptospirosis than brucella these days. Yeah, I think pasteurization has made a big difference.
Thank you. So thank you, Dr. Padma. Anyone has any questions? Most welcome.
Yes, Dr. Ramesh.
The diagnosis of post-fever retinitis is basically on the clinical presentation and the history of fever. So what is the need to do so much of investigations to identify the causative infective organism? Where primarily, even if you look, primarily your treatment is going to be lined basically with the reduction of the inflammation with steroids. So my question is that when we see a clinical picture which is typical of a post-fever retinitis, do you really want to do so many serological investigations and identifying the causative microorganism?
Yes, because the treatment is going to differ. If rickettsial is there, you're going to put doxycycline and steroids, whereas in other conditions, steroids can be given, or certain entities, spontaneous improvement is also there, and she's pregnant. We can't put blindly steroids in a case, and it's important we need to find out the reason to predict the outcome of fetus and the chances of fetus getting infected. If she has an infective cause, it's important to treat her with appropriate antimicrobial therapy to prevent the sequelae in the fetus. I do agree, if you have a post-fever retinitis, morphologically all look the same. Only the serological and molecular diagnostic help us to differentiate between the entities. But in this particular case, it is important to find out the cause and treat than just the observation because of the pregnancy.
So does adding an antibiotic actually help in the faster resolution of the disease, better structural retinal findings, or it doesn't make a difference whether you add an antibiotic or you don't add an antibiotic?
Unless we do a randomized control, it's very difficult to comment on it. But we have done the study for other post-fever entities, not in case of brucella, where we have observed, put doxycycline and steroids, anti-VGF. And finally, what happens is when you put steroids or antibiotic, it helps in the faster resolution, but the visual outcome or the anatomical, it's not going to change.
Thank you.